Thank you so much for your patience. We'll start the broadcast of Dr. Soni's webinar on lower eyelid rejuvenation. Today, this is given by Dr. Prashant Soni of Advanced Cosmetic and Plastic Surgery, and he's going to give you a full overview on ways to get a smooth lower eyelid appearance. And before we begin, let me just tell you a little bit about Dr. Soni. If we could advance the PowerPoint, that would be great. Thank you. Dr. Soni is a plastic surgeon, cosmetic surgeon at Advanced Cosmetic and Plastic Surgery, and they have offices throughout Fairfield County. He is board certified by the American Board of Plastic Surgery and the American Board of Surgery, and he was recently named as one of Connecticut Magazine's top docs. So congratulations, Dr. Soni. He has a medical degree from Harry Medical College in Nashville, Tennessee. He did his residency in general surgery at New York Medical College in Valhalla, New York, and a residency in plastic surgery at the University of Utah Health Science Center in Salt Lake City. And now I'm going to pass along the broadcast to Dr. Soni, who will start the presentation.
Thanks, Carol. So thank you, everyone, for coming in today and then attending this lecture on lower eyelids. It's a great topic for me to give a talk about because I can't think of too many things that have more publicity on the television and on the internet and things like that, but is one of the most poorly understood parts of the anatomy that I regularly treat. So I'm going to kind of explain how the lower eyelids can be treated in a way that addresses everyone's concerns, and you'll see that there's a stepwise way of doing it. So let's start off my talk about what really we're aiming for. What are our goals? Everyone basically wants to recreate or maintain that flawless, smooth look that we had when we were teenagers, let's say. And that means that it's essentially imperceptible that there's anything involved with the lower eyelid. There's no perception of excess fat or extra wrinkly skin or discoloration. It all blends harmoniously, so to the point where a beautiful lower eyelid is an eyelid that does not attract attention. And that really is the goal when we're doing, or when I'm trying to find out what will work for someone in rejuvenating their lower eyelids. So a couple of facts, and some of these are, hard to accept, but it's true. Everyone's face, more or less, is genetically programmed to start having changes at around the age of 30. It's in our DNA, and there's not too much we can do to change that. Certain things we can do to prevent the worsening of that fact or the acceleration of that fact are things that I'm going to talk about. And a lot of that has to do with the environment, or how to fight off the effects of the environment. The eyelids are unique, though. If, say, the rest of the face starts showing signs of aging at around 30, I would tell you the lower eyelids are probably the single area of the face that starts showing signs sooner. And why is that? The reason is that there's no place on the face that has a thinner skin structure than on the lower eyelids. I mean, the skin there is very, very thin. There's not really any thick fat density or heavy muscular tissue there that insulates our tissues and gives us a little wiggle room or time or deferral in the appearance of the aging process. Add those qualities of the skin itself and in the environment, which we're all prone to, and you start seeing changes in the skin, the shape, all those things coming through much quicker. So when I talk about everything that I'm going to talk about today, is really how to anticipate those things that are going to happen and with the anatomy in mind. So when I see anyone who comes in who says, I really just hate the way my eyelids look, I feel like I look tired, and by and large, one of the main reasons is their eyelids. The lower eyelids have, an amazing effect on the overall perception that other people have on your state of health and just how tired you may feel or how enthusiastic you appear. And none of it may reflect your true inner mentality, but the perception is there. How we address that is dependent on what the problem is. So let's think about what the anatomy of the lower eyelid is in three general ways. The eyelid, the lower eyelid specifically, has three things: the skin component, underneath that is a muscle component, and underneath that is a fat component. So there are three things that individually collaborate to make someone's lower eyelids look more tired or aged. However, it may not be all three at the same time. It may be that one is in excess of the other two, or two are taking over and one is completely benign. And there is no one thing that will address all three things. And quite frankly, if you use the wrong treatment and address only one component and leave the other two that are really the reasons for things, you're doing nothing for yourself. So from a plastic surgeon's point of view, whenever we see somebody or when I see somebody, my immediate thought is which of these three components is participating in the aging appearance, and which one has the precedence that we have to address first and foremost. So all of this means that there has to be technology that is addressing those things without necessarily causing effects or unnecessary effects on the other three. And this is where the technology of today has come to a forefront. And there really are many, many things that are out there that we hear about that are, some are fantastic, some are completely not useful at all and are entirely due to marketing hype that you see out there. And I'm going to elucidate what I think works, what I have used, and you'll see pictures of those effects. So when I think of what we're going to do in the three components, it's all about trying to create a game plan or a treatment plan that addresses each component individually. And I'll titrate the treatment to that component as is needed, no more, no less. And that's really how you get the results you at least want, not necessarily the results that I am capable of just giving you because this is the one thing I do. It's really what will get the job done. So let's start off with the simplest thing, which is something everyone can do, and that's treat the skin. So the skin was the first of the three components of the lower eyelid that I mentioned, and quite frankly, it's the simplest thing to address, and it's the easiest thing to address prophylactically, and it's the most important thing to address after any procedure I do to keep the results we're looking for. And this is the skin regimen I recommend to virtually everybody. Involves using retin A, and the concentration you see there is a very low dose, but it's much higher in concentration than anything you'll get, let's say, at a Macy's or at a fine retail area. This is a medical grade concentration. However, it's the lower of the concentrations that are available. We use much higher concentrations on the rest of the face or the neck, but this is perfect for the lower lids. Most people have some degree of hyperpigmentation and darkening of the lower lids. And it's entirely because it's exposed to the sun so much. And there are multiple types of therapeutics out there. Some are prescription grade, like hydroquinone, which you can use for severe darkening and use for a short period of time. But there are other things like Triluma and Lytera. All these two things I've mentioned are all basically prescription grade, and I will titrate to what the person needs. But almost universally, everyone needs this. Other adjunctive things, though, that we know work are things like topical vitamin C, which helps with the antioxidant effect of the skin. Every time we are exposed to sunlight, there is some DNA damage, and vitamin C will accelerate our ability to repair DNA damage. Growth factor serums are a new advance that basically are proteins we apply to the skin topically that help our skin maintain its productivity and its metabolism so we can fight skin damage, maintain collagen production. And the obvious things like sunscreen to prevent environmental sun damage are all important. These are all topical things that people will do, some of them every day, some of them every other day, or maybe even every second or third day. The point is to be on a regimen, and this will insulate you from so many things and often bring people back in time just from the simple regimen. Some people will have very light chemical peels just to kind of maintain the efficiency of the topical home treatments. And these are simple things that shouldn't carry any downtime that are typically done by an esthetician or myself. This is the single regimen that I recommend for almost everyone that addresses the skin. And that's the component that I think most people are deluded by what they see on the TV and things like that. And I'm just going to show you a little pictorial thing. You can just look at the diagram I have here, and this will explain why this regimen that I mentioned works. If you look at this little diagram, you'll see this picture of the skin. It's almost a microscopic cross-section of the skin. At the very top, where you see the word epidermis written, you see these kinds of skin cells that almost look like scales. And that is the layer of the skin that's exposed to the world. Below that is another layer of skin that's a little more plump, and below that you'll notice these cubical types of skin cells that look nice and fat. Those fatter skin cells are the ones that are being formed continually, well actually every 21 days you're getting a new layer of those skin cells. And those are the fresh, hydrated, youthful skin cells that are waiting to rise to the top. The problem is that as we get older, that dead, dehydrated skin layer on top just sticks around and inhibits the fresh layer from rising to the surface to be seen. This skin regimen that I've mentioned is all designed to accomplish two things here. It's designed to remove the outer dead kind of scaly skin and make room, give it basically a doorway for the healthy skin cells underneath to rise to the top. And the retin A and the vitamin C and all those things basically facilitate a faster, more plumper, hydrated skin layer to be produced underneath so that it can be rise to the top much more efficiently. All that is to basically try to get the healthy skin cells to the top. People who just put on moisturizers and don't really do any of the other things I mentioned are just trying to hydrate a dead skin layer at the top that really is almost like a barrier to the healthy skin underneath that can absorb hydration. So in the end, everything I mentioned is designed to accomplish that one principle. Now, I'm actually going to go back one. If you look underneath the skin cells, you'll see an area underneath called the dermis. So moving forward, this diagram on your right, you'll see another kind of cartoon depiction of the skin. The skin that I just described is the purple layer on top, and below it is the layer called the dermis. So this beige-brown layer underneath, where you can see the little blood vessels and everything, that is the segment of the skin that retains the collagen. So you can see, if you look between the diagram that says youthful skin that's on the left and the older skin that's diagrammed on the right, you see how the skin is all wrinkly and curvy. And the reason for that is that the collagen, or the dermal layer, the beige layer on the older skin, is narrower. It's depleted. You can see that there's not as many of these cross-hatched collagen fibers in there. So wrinkly skin, especially on a thin skin layer like the lower eyelids, is often the cause of that is due to a depletion of the collagen in the dermal layer. This skin regimen I mentioned is not only designed to help the epidermis, or the skin cells that are on the surface, rise to the top so that they can be seen, the retin A and the vitamin C actually affect the collagen production and speed up the metabolism of that collagen production in this beige layer, which is your dermal layer. If you can maintain a fuller, more turgid, plump dermal layer, you automatically start seeing a tightening of the skin that's above it. So you can take back the older skin and make it look more youthful. And it's all can be accomplished to some degree with the skin regimen alone that I mentioned. Clearly, people who start the skin regimen earlier in life will delay the progression of this. People who start the skin regimen when signs are starting will be able to bring things back and rein them in so they look younger and go back years in time. But people who are gone beyond a certain level will have to start addressing other issues. And these are just examples of people who started just the skin regimen. And you can see that this is the same person on the left. Their skin had wrinkly, crepey appearance. It had a lot of hyperpigmentation. I can say she didn't have much bulging or fatty deposition in that area. It's not like she has the puffy eyelids. It's entirely a skin textural issue. And just by doing the home topical treatment alone, you can see the clarity and the tightening effect that has happened on the skin. And this can be accomplished just by doing things at home. Now, occasionally, I mentioned we can do chemical peels. And this is something that people probably aren't too familiar with. And everyone's mind tends to go to lasers because lasers seem the avant-garde thing to do. But I will say that lasers are based on the premise of injuring the outer layer of skin to get to the plumper skin cells underneath that naturally want to rise to the surface. And it's also, lasers are designed to basically remove the outer skin cell layer so that you can traumatize the dermis underneath to kind of heal itself and make things look tighter. Peels don't work like that. The chemical peels work on the premise that the peels will penetrate the skin and actually absorb into the DNA of the skin cells and force the metabolism of the skin to do everything that the home regimen does, but in a much more exponentially accelerated way. So this is a great way for people who have kind of gone past a certain point in the aging process. We want to rein their skin into a more manageable state. We do 1 or 2 peels separated maybe several months apart. They carry maybe a 1 to 2 day pink flaky period, and then they're ready for the skin regimen, and that usually carries them through to the final effect. It's a nice titratable, easy way that doesn't require a downtime, that doesn't require discomfort to get the results we're talking about. So here's a person who was started on a skincare regimen 2 weeks before. I did 1 chemical peel and then started her back on her skincare regimen 1 week after. And this is her maybe about a month after her chemical peel, and you can see the effect it had on her lower eyelids. And this is maintainable indefinitely in terms of skin texture if she continues to do the skincare regimen. If you fall off the skincare regimen bandwagon, things will start to creep back. You can't fool the body just by doing something once or twice. It has to be a maintainable kind of effect, but you can truly maintain these kinds of results. And it's just a close-up of it. Okay, so I think this is the skin was probably the simplest thing I can mention to you because it's something that people can take care of themselves by and large. But now we get into the area of the muscle, which, if you recall, was the second component of the lower eyelid. Not everybody has this issue, and a lot of people, this is their only issue. So when I look at someone, I have to address if the muscles are contributing to the problem and to what degree. And the best way, the simplest way to manage muscle issues is with Botox. And Botox has been around since the 60s, and it's used all over the body for different things, even for internal organ reasons. But its cosmetic use is well documented, and it's been around for decades, and has a very, very good safety profile. The whole premise of Botox is that certain muscles will thicken around the face due to habitual squinting, habitual frowning, and those affect the appearance of the eyelid. So basically, the idea with the Botox is to selectively relax the muscles where they're causing the cosmetic concern and maintain this every 3 to 6 months, depending on the degree of severity of presentation. And this is just an example. This is one of the most common things. People present with crow's feet or those lines emanating off the corner of your eyelids, and they affect when you smile, you feel self-conscious. So here's someone who has the crow's feet on the left side, and with a little Botox literally a week later, they're gone when they smile. And that is so simple to do. It requires just a few units of Botox done every few months, and this problem can be kept at bay. Now, that's the muscle component in a nutshell, basically. The third component, though, is the fatty component, which is the deepest component that sits below the muscle layer. And it is the fatty component that is responsible for that puffy eyelid look that makes people look like they have allergies or are tired or just woke up. And it often fluctuates from day to day based on seasonal allergies or stress or how much you slept. But it is due to the fat component that is there and has always been there. However, certain things have changed the way the skin resists the pressure or the appearance of the fat. So there's something that you need to know anatomically called a tear trough. And what is a tear trough? If you look at this picture, focus on the left picture. You'll see the eyelid. You see the little eyelash at the top of the picture. And if you follow this diagram, hopefully you'll see that there's the skin, which is the pink layer on the outside. You see this kind of purplish color, which is the muscle layer we talked about. And underneath that, you see a green layer, which is this little fibrous band, which I've labeled the septum. Underneath that is this yellow globular stuff, which I think, as you can imagine, is the fat layer. This fat layer that you see in this left picture has always been there. You were born with it. It grew to a certain proportion with your growth rate as a child. And as an adult, it has neither grown nor decreased in size, whether you gained weight or lost weight. What is different is that the septum and the structures in front of the septum have weakened over time and allowed the fat to push forward and cause a bulge. So the same fat that has always been there starts to slowly create this puffy eyelid look. And you can see externally on the picture on the right, there's also fat that sits underneath the skin that kind of pads your entire cheek area. So these are the two fat components when they have changes in their position, not necessarily changes in their volume, but in their position. People start to get a puffy eyelid appearance. Now, the idea here is that, I'm going to go back to this picture. You can inject fillers, and a very popular filler I like to use is something called Belotero, which has been on the market for a few years now, a couple of years. And I can use it to kind of sculpt the shape of the puffiness and the fat to blend harmoniously into the face. And this is the product Belotero, and it's injected into this area where, if you look at this picture on your right, you saw this picture before. If I inject it into the dermal layer, that beige area, it helps camouflage things. And there are multiple fillers out there, and some of you might have heard of some of them. Restylane, Juvederm, Perlane, Radius. All of them are applicable in different ways. But when I'm doing exactly the lower eyelid, I find my personal preference at this stage in the technological state of things is to use Belotero. And here's a perfect example of someone who I used a filler to not necessarily remove the fat or reposition the fat that was causing the effect, but I used Juvederm in this case. This is going back a few years, and Juvederm was the thing I used here most often until Belotero came along. And you can see that by filling in the depressions that are surrounding the fatty bulges, I'm able to make everything look very smooth. And this is done in the office within a couple of minutes. Patient walks out the door, and there's no downtime, and the effect lasts up to a year, if not more. Here's someone who has a more visual evidence of the fatty, puffy depression there. And this was not done surgically. This is someone a week after I did Juvederm to her lower eyelids and her cheek. So you can see how effective a filler can be in getting rid of the puffy appearance. Now these two people you just saw have virtually no evidence of extra skin or wrinkling. They're entirely a fatty component and maybe a little bit of discoloration, which was taken care of by skin management. So combination of skin care and injectables can give you this kind of result. So when I put everything together, I've kind of discussed the three things that I do in the office. The point is for me as the surgeon to see where the components are presenting themselves and to what degree, and address each component specifically. You'll find people who will almost always universally do skin care but just need a peel, or just do skin care and maybe need fillers. But there's some people who will do skin care but then move on to other things like surgery. But in terms of harmonizing the non-surgical things I do in the office, you can see these are all people who have done multiple things. So here's someone who, on the left, I addressed what I saw as skin discoloration, fat deposition that's not in the right area, and a little bit of skin wrinkling. So the effect of this was to do some fillers using Juvederm around the eyes. I used Radius, which is a filler that I used to volumize her cheeks so that they blend into her lower eyelids. And then I did a chemical peel on her face and her lower eyelids. I also did a little filler into her lips. The effect of this is to give almost a facelift. And many people would have said, let's do some eyelid surgery and a mini facelift, and none of that is necessary in someone like this. This can all be done by once-a-year treatment with fillers, and the peel, which now she's on skincare, should never have to be repeated ever. Here's someone that I did a combination of things. I did do an upper eyelid lift on her, but her lower eyelids were entirely addressed with chemical peel and Botox. She had no fatty bulges. She just had a little wrinkly skin and some discoloration. So the Botox, a chemical peel to her lower lid, and good skin care, and a little Belotero to the tear trough are all I did to rejuvenate her lower eyelids. And I did do an upper eyelid lift, though, which was an entire separate thing, which can be done in the office at the same time. And here's someone else who I did a couple of things. So besides doing a little work on her nose, which I did do surgically, I did a combination of Juvederm and Radius and Botox to address the areas around her lower lid, the little pink marks where I injected her Botox. And you can see the effect that is completely non-surgical in nature for the lower eyelid rejuvenation. And this is someone who I probably only have to see every 2 years, if that. And here's another person who I did do an upper eyelid procedure, which is almost universally a surgical procedure. But since we're addressing the lower eyelids, I thought this was very indicative of what can be accomplished with just a little filler to the lower eyelids, Botox around the eyes, and a TCA peel of the lower eyelids. And this is someone 2 weeks after the procedure was done. So, seeing how much can be accomplished when you titrate the right treatments to the right component problem, it begs the reason, when and why do we ever need to do surgery on the lower eyelids? And there are a couple of reasons. One of the most common reasons is that some people simply are not interested in coming in and having me do some things to them every 1 or 2 years. Even though it's just done in the office, it's not uncomfortable, you walk right out, they just aren't in the mode of doing those things. Either they have a busy lifestyle or they simply like the idea of something permanent. So those people, they're great candidates for doing things like fat repositioning or fat reduction if that's part of the problem. However, like I mentioned, as little input as people want to have in their, some people may want to have in their maintenance of their lower eyelids, nothing can replace good skin care for the lower eyelids. That's not something I can do for you, something people can only do for themselves, and yet if they choose to ignore it, then they'll simply have to come in more frequently for peels. The other aspect, though, is people who simply have too much skin excess or too much fat prolapsing for me to do an excellent job with a filler or a chemical peel. There is a level at which you can get a certain amount of result but not get the best result. And those are people who I will often refer to and have had to do surgery on them myself. However, occasionally they will be under the misconception that things like fine wrinkles, poor texture, sun damage can be addressed surgically. Surgery is designed for architectural shaping issues. They will not improve the texture, the quality, the color of your skin. All those things require maintenance, like I mentioned. So how do you perform a lower eyelid lift surgery? And there are two techniques. I'll explain both of them just because you'll see this on the internet. One is a technique called a transpalpebral or an external approach, where an incision is always made in the skin on the outside to gain access to the muscle layer and the fat layer underneath. This always requires a small incision underneath the eyelashes, which, truth be told, heals beautifully. However, I choose to use an approach that is more component-based and requires often no surgery on the outside, no incision that's visible. Because if you understand the concept I'm mentioning, some people have certain components that need to be addressed. So if I see someone who has excellent skin, no wrinkling, but just has fatty eyelids, and they want to have surgery, there's no reason for me to make an incision externally when there's a way I can remove the fat without an incision. So I'll kind of show you that technique, which is called the no-touch or transconjunctival approach. I mean, I won't belabor you to read this. You certainly have access to this webinar later to read all the details. But the idea is that this diagram shows that you have the bulge there on your left picture, and some people will access to get to that fat by making an incision outside. And they'll be able to trim the fat back so you can see how it sits flat against the face. My technique, which is the no-touch technique, basically ignores an incision on the outside, but you can see how I can access the fat, this little arrow you see on the diagram, from just the inside of the lid through a small poke hole incision that doesn't even require a stitch. The lower eyelid procedure does require you to be under sedation, so I always do the surgery in the OR, unlike the upper eyelid surgery, which I often do in the office under just local anesthetic. But the beauty of this technique is I can remove the fat if that is all you need without having to make an incision externally. And if you have great skin care, that may be all you need. If you need a chemical peel, that may be all you need. However, if a person has a lot of extra skin, I will also remove some extra skin there. So this slide basically just summarizes what I was saying, that the internal approach I use addresses the fat layer specifically without touching any other layer of the skin, and we can titrate the treatment to those other layers as are needed, if they're needed. So here are just some examples. Here's a lady who wanted just her fat removed, no incisions on the outside, and all I have her on is doing a little chemical home care regimen. I think she would benefit from another chemical peel on the outside, but the fatty bulges are removed with absolutely no incision made on the outside. But here's a person, for example, who I did do her upper eyelids and her lower eyelids, but I removed the fat and the skin, and this is her maybe a couple of months after the surgery. The effect of this is permanent. If she continues good home care at home, she will not develop loose, flaccid, discolored skin again. And she simply will never get these fatty bulges ever again because the fat has been removed. It cannot regrow in this area. This is just the same patient from a different view. And here's another person. I did nothing at all but remove the skin. So I didn't go for the fat layer. I didn't go for the muscle layer. I simply took out these little extra pouches of skin called festoons, which in her case are uniquely low on her face. But nevertheless, she didn't need all the other things done. And here's a gentleman, and here's a perfect example of people who probably could have done fillers and things like that, but aren't going to come in every year or two. He just wanted something done efficiently, quickly, and last, for the rest of his life. And so him, I did a surgery. This is him 1 week later after I took out his stitch. And we can see the fat is gone and the skin is nice and tight. And here's someone who's 10 days after surgery. I did his upper lids, and I removed extra skin and extra fat. And he doesn't really care about skincare too much. He's too busy, and this is not his kind of way of doing things, and the guys are like that. But nevertheless, a much more rejuvenating effect, and for 10 days out, this is healing very easily. Here's someone who I did many things, so don't be fooled into thinking that she looks, nice like this much better just because of the eyelids. I did do a facelift, but the lower eyelids are very indicative of a result you can get just maybe a month or two after surgery. I did the fat removal and some chemical peels on her lower lid, and this is the result. So in terms of just generally asked questions, this is usually when I'm seeing a person in consultation. These are almost the rote questions that come up. Where does a lower blepharoplasty get performed? Can it be performed in the office? The answer is I don't think it's comfortable for a patient to do it in the office. I do lots of things. All the fillers, the chemical peels are done in the office, and they're comfortable, simple things to do. But when we're trying to remove the fat layer, and mind you, I do the technique from an internal approach, I need people to be calm. They won't feel pain, but it's disconcerting for someone to feel someone moving in such an intimate, close area without having some benefit of sedation. So I universally do my lower eyelid or lower blepharoplasty surgeries in the OR. The recovery period, obviously this differs for people, but recovery has to be thought of in terms of stages. When can I drive is probably the next question. And in general, most people, their swelling is down enough by day 3, maybe 4. I feel it's safe enough for them to drive, and their swelling is down enough that they can see things comfortably and safely. Not everyone is like that. I mean, certainly people are on blood thinners or things like that. They're going to be more bruised and a little more swollen. The stitches come out around day 6, so most people are putting on makeup to hide whatever residual bruising is there by day 6 or 7, and they're comfortable in public. I would say by 10 days to 2 weeks, even without makeup, most people feel very comfortable going out in public. And for guys who have done the surgery, by 10 days, they're universally, I've been feeling people are very comfortable, and guys don't wear makeup. Can the lower blepharoplasty procedure be done with other procedures? And the answer is absolutely. Whether you stagger them and do some procedures in the office or do them at the same time in the OR, whether it be a facelift or upper eyelid surgery or liposuctions, it's a small procedure. It only takes me about, let's say, an hour to an hour and a half to do in a lower eyelid surgery. So it's a very small amount of time in which you can piggyback that on other things to have a surgery that can be done on an outpatient basis. And do men and women benefit from the blepharoplasty? And the answer is absolutely. I think there has to be a different aesthetic approach to men. Men want to look younger, less tired, but they don't want to look feminized. So men generally are not looking for a porcelain, smooth, 20-year-old appearance. They're looking for an appearance that is commensurate with their age, perhaps gives them a little bit more of a regal, mature look without looking tired. So there's usually less work done on the skin, and most of the focus on my part is done on the fat component. So very often with men, I will just remove the fat with a no-incision technique externally, and that is where they look their best, and they look like themselves, and often people won't know why they look better. They just look better and more relaxed and more enthusiastic. Women often, though, want their skin to be a smoother porcelain appearance, so that's when I will do adjunctive things like either remove skin or combine it with solid home care regimens and maybe a couple of peels in the office. And does a lower blepharoplasty get covered by insurance? And this is usually triggered by the fact that upper eyelid surgery often is covered by insurance, because upper eyelid skin can actually hang down and impair your vision. However, lower eyelids don't do that. By virtue of already being below the level of your eyelids, they don't impose a visual restraint on your eyelids. It's essentially just cosmetic. So any kind of lower eyelid blepharoplasty is not covered by insurance. So in summary, just to kind of put a lot of stuff into one principle I want everyone to go away with, it's almost invariable that everyone will have some sort of lower eyelid cosmetic concern in the future. I mean, whether or not it bothers them is obviously a personal issue, but you can't think that any one treatment will work for everybody. It is absolutely impossible for any cream, any kind of injectable to say, or even any one surgery to say, this one thing will address all the things that you could possibly have. It requires a strategy that addresses each component. And some of those components are self-maintained, some are in the office maintained, and some are in the OR addressed. But a rejuvenation plan has to be in place to address those things uniquely. And as you can imagine, everyone is different. So the rejuvenation phase, if it involves surgery, is what I do in addition to all the things in the office to get you to where you want to be. And in the end, maintenance plans and home care regimens and things like that will help keep you where you are. And that's really the philosophy I want to kind of put out there. And I'll give it back to Carol.
Thank you so much. I just wanted to open up now to see if anybody has any questions. If you have any questions, you can type them right into your GoToWebinar control panel where it says questions, and we'll just wait a minute or two to see if anybody has any questions. You can type them now, and I will read them for Dr. Soni, and he will be happy to answer them for you. So if you have any questions, please type them now. We have a question from Kristen. She says, how much fat is removed?
It's interesting. It is different for different people, because certainly some people have more or less, but it's never very much. If I were to give it to you in some sort of descriptive terms, the amount of fat I get from each lower eyelid maybe adds up to 1 or 2 cc's or 1 or 2 milliliters. That is almost, if you think of a grape, okay, that's about as much fat as you could take out in someone who has a lot of fat. It's amazing how much of an effect it makes when you remove that little amount of fat, which is why it's a relatively non-invasive thing. I mean, it is a surgery, but it can be accomplished through a small little incision made on just the inner aspect of the eyelid, and I can literally just suck out the fat very simply because there isn't very much that we're going for. It's about knowing where it is and knowing the anatomy, and that little bit of removal is what it takes. And like I mentioned, that fat will not grow back. If fat has not been removed in a particular area, that fat may present itself as your tissues weaken as you get older. But I make a habit of addressing and looking for, if I'm going in surgically, I'm even looking for those fat deposits that will eventually present themselves later on, because there's certainly no downside to prophylactically addressing it, and that's how I take an approach to it. The look that you get is great immediately, but you prophylax against having any aging or fatty prolapse later on.
Okay, we have another question from Danielle who asks where Dr. Soni performs his or her procedures.
It depends on the venue. it depends on how much I'm going to be doing. So, you know, my office procedures are done here in my office in a regular chair. You'll walk in, we'll chat, we'll put a little numbing cream, do the procedure, whether it be a filler or a peel, and then you go home. That's simple. I mean, it's not unlike coming to my office to have a mole removed or something simple. The surgeries I'm talking about are done in an outpatient setting. So I work in Danbury Hospital, New Milford Hospital, and Ridgefield Surgical Center, and also at St. Mary's Hospital. So if I'm doing just say the lower eyelids, which is a quick procedure, you really have your choice. I mean, some people will choose to have an operation done close to home. Some will have it done in the Ridgefield Surgical Center, which is purely outpatient. It's when I'm doing surgery on someone, I'm doing multiple other things. So let's say I'm doing a breast reduction, a tummy tuck, liposuction, and then the lower eyelid surgery. Those are a lot of surgeries that cumulatively add up to a lot of time. So those people may choose to spend the night in the hospital setting before they go home. So then I would do the lower eyelid, obviously, in the OR, because I'm doing it in combination with other things. In and of itself, the lower eyelid surgery is a very simple outpatient procedure, but it can be done at an outpatient surgical center or a hospital. I only operate in OSHA certified and state monitored facilities. So we know that they have the highest standards and they're safe.
Okay. I have another question, which asks, I'm not really quite sure what this means. It says internal procedure.
Mm-hmm.
Yeah. It says,
yep.
well, is that a question for you, Dr. Soni? Do you understand that?
Well,
is this an internal procedure? Is this it just says internal procedure? I'm not sure if that means is this an internal?
I think what whoever's writing this is this a procedure that is done either the external approach that I mentioned or the internal approach? So, like I said, there are two different ways of doing it. The internal procedure is the technique I prefer because it allows me to get the fat layer out without making an incision on the skin. You know, and a lot of people don't need their skin removed. So that is one way to do it, and that's the way I like to do it because I'm just philosophically inclined towards just treating what needs to be treated and not having any collateral surgery or collateral incisions that need to be done. So that is the internal procedure that I do. Not everybody does that. There are a lot of very good plastic surgeons who still abide by the external technique and have excellent results, but by virtue of doing that technique, you need a skin incision even if you don't need skin removed.
Okay, and similarly, with this internal procedure, is the tear duct affected? Another question.
The answer is it is not. It is not.
Okay. And if there's any other questions, now is a good time to type it in. And okay. I think that we have had all the questions answered. And I just wanted to thank everybody for coming. And Dr. Soni, thank you. And
thank you, everybody. Thank you, Carol.
You're welcome. And if you have any more questions, you can go to ascdocs.com, which is a lot of information about advanced cosmetic and plastic surgery. Or if you can call 1-844-ASC-WELL for a consultation or for any questions. And thank you once again, everybody.